Okay, thank you all for joining me today. Imagine an invisible thread connecting this chart, a hospital doorknob, a patient's chart, and an open surgical wound. On that thread sits a microscopic army. According to the Centers for Disease Control and Prevention, on any given day, about 1 in 31 hospital patients contract at least one infection while they are already in the hospital. Whether you're working in healthcare, visiting a sick loved one, or just trying not to bring bugs home to your own family, the way you can clean your hands can be a matter of life and death. Breaking this chain of infection is both an art and a science, and fortunately, the CDC gives us an exact game plan to wipe those bugs out. I have spent the last 5 years working in healthcare, and I have seen firsthand how fast a microscopic threat can turn into a major medical crisis. Today, we're going to look at the dangerous history of these pathogens, walk through a quick, compressed demonstration of the core mechanical hand hygiene technique, and talk about how to walk away without immediately ruining all your hard work. To understand why we sanitize or wash, we have to look back at the 1840s. A doctor named Ignaz Semmelweis noticed something simple. When doctors washed their hands between patients, mortality rates plummeted. Today, we know hand hygiene is our absolute primary line of defense. According to the World Health Organization, our hands carry two types of bacteria: harmless resident bacteria deep in our skin layers, and nasty transient bacteria we pick up from everyday hospital surfaces. These are the hitchhikers we pass to patients like MRSA, which can travel straight into the patient's bloodstream and cause deadly sepsis. Now, for our demonstration purposes today, I'm going to be using an alcohol-based hand sanitizer to show you the mechanical motions. However, in a real clinical setting, if you're fighting a spore-forming bug like Clostridium difficile or C. diff, alcohol gels do not kill it. Only a physical wash with soap and water can mechanically strip those spores away. So let's dive into the core mechanical friction technique, which the CDC states must last for a minimum of 20 seconds to be effective. First, after you get your hands wet in the sink, as I'm at the sink, you put some soap on. You're going to rub palm to palm to evenly spread the product out. Second, you're going to interlace your fingers with your right palm over the back of your left hand and the left palm over the back of your right hand. Third, you're going to take each thumb and opposite palm, give it a solid rotating scrub. And fourth, take your fingertips in a circular motion directly against your palms. The CDC notes that the area right under your fingernails holds the absolute highest concentration of pathogens on your body. Remember, whether it's soap or sanitizer, it's the physical friction of your skin rubbing together that actually detaches and destroys those stubborn bugs. For hand sanitizer, you want to keep rubbing until your hands are dry. For soap, after you're done doing all your scrubbing, you're going to rinse your hands, fingertips down into the sink. You don't want any dirty germs to travel up your arm. So after you get all of your soap off, you would grab your towel and dry off your hands. Now, when you go to turn off the sink, you want to take that towel and turn off the handles with the towel. Touching that with your hands is just going to put the germs back on your hands from when you started to turn on the water. Hand hygiene has come a long way from being an ignored 19th century theory. Today, it is the absolute baseline of modern patient safety and is the cheapest, most effective medical intervention in human history. Millions of dollars in advanced hospital technology, ventilators, and specialized surgeries can be completely wiped out by a single pair of unclean hands. Next time you apply hand sanitizer or step to a sink, remember that those 20 seconds of friction are the easiest way to ensure that your hands remain a tool for healing and never a vector for harm. Thank you.